OSCE pre-check. Before performing any clinical procedure, nurses must complete essential pre-checks. The first one is closing the door to provide patient privacy. We can just close the door and say, I will just close the door to ensure my patient privacy. In an OSCE station, checking the scene is safe is the next one. It is important and first step that shows situational awareness. How to check the scene is safe? We can just pause at the entrance before approaching the patient and visually scan the environment for spills, wet floors or any obstacles, loose cords, clutter, blood height or any other biohazards. Check that you have the space to work and move safely and say the seat is safe. The next one, hand rub. You need to do hand rub at least 20 to 30 seconds to avoid the spread of infection and ensure patient safety. This shows that you understand and why you are doing it, not just how. Why hand rub is important in OSCE? For infection prevention. The main steps that we need to follow during hand rub. First, you need to apply enough alcohol rub and cover all your hand surface. Rub your palms together. Right palm over left dorsum and vice versa. Palm to palm with fingers interlaced. Back of the fingers to opposite palm. Rotational rubbing of the thumbs. Rotational rubbing of the fingertips in palm. Then after that, allow the hands to air dry completely. Next one, self-introduction while approaching a patient. You can say, hello, my name is, tell your full name and say, I am one of the nurses here today and tell your purpose of visit. You are here to do your observations or you are here to give the medications or you are here to change the dressings. Is that okay with you? Examples for different stations. In vital signs station, you can say like this, hello, I am Mr. X. I am a registered nurse. I am here to check your vital signs. Why this one is important in OSCE? It will demonstrate professional communication, builds trust and rapport with the patient, shows respect and consent, helps you to score higher points in OSCE. In OSCE station, it is very much essential to always obtain consent from the patient before performing any procedure. It respects patient autonomy and rights. It helps to build trust and cooperation. Important reminders, never assume consent. Always ask clearly. If the patient declines, respect it and document or escalate as appropriate. In the OSCE, checking patient ID is crucial safety step that must be done clearly, confidently and verbally. How to check the patient ID in OSCE? Greet the patient first. Say your name and say, I will be your nurse today. Then you can ask, can you please tell me your full name and date of birth? And cross-check with your documentation. Look at the patient ID and also in the file. Please just ask the patient to tell your full name and date of birth. And you can say the NHI number also from the file. If anything does not match, never proceed with any care or medication if there is a mismatch, and you need to escalate this one to the in charge. Okay, you can do the checking like this. Always make sure you need to obtain the consent for touching the patient. You can ask, may I touch you, and check the ID band. Say thank you always. OSCE pre-check conclusion. First one, knock the door, enter, and closing the door to maintain patient confidentiality. The second one, checking the scene is safe. So you can just check around and say the scene is safe for me to approach. And do the hand rub by following all the steps of hand rub. After that, take the patient file or scenario sheet from the cardiac table and approach the patient. After that, you can introduce yourself. You can say just, hello, my name is Mr. X. I am one of the nurses here today. Or I am the nurse who is taking care of you today. Then after that, first you need to do the patient identification. Just ask the patient, I just want to confirm your ID. May I touch you? Say thank you after that. Then you can confirm the ID by asking, can you please tell me your full name and date of birth? And also do checking that against your ID band and the care chart. You need to take the consent for the procedure. Then preparation of the equipments. You can check all the equipments and make sure everything is clean, sterile and within date. Then after all your procedure, you can just review your documentations. Tips for OSCE pre-check. Always verbalize your actions clearly. Make eye contact and show empathy. These all are the steps. Take under 2 minutes and earn you crucial marks.